So good evening. Thanks Lisa for this introduction. So as Lisa says, I will talk about our recent results that we have obtained regarding SARS-CoV-2 infection in non-human primate. A quick introduction of the challenge to study long COVID. So as you know, long COVID refers to a range of symptoms that persist for weeks or months after the acute phase of infection. And it's now well admitted that the combination of factors might contribute to long COVID symptoms, such as viral persistence, tissue damage repair, immune dysregulation, or chronic inflammation. Understanding the biological underpinning of this multi-symptom requires extensive detailed research, which are difficult to perform in humans, especially if you think about deep tissue. So in this context, we decided to develop a model of long COVID, of non-human primate model of long COVID. For the purpose of this study, 32 cynomolgus macaques were involved. 7 were used as healthy control, 15 were infected with the Wuhan strain, and 10 with the Omicron strain. After an acute phase, we wait 6 months, at least 6 months, and we perform different samplings such as blood, bone marrow, and bronchoalveolar lavage. And for the purpose of this talk, I will focus on the results that we have obtained on the bronchoalveolar lavage. So, as for human, 21 days after infection, the virus is not detectable in both nasal and tracheal swabs. And we perform different measures during the convalescent phase, and we are not able to detect any viruses in the upper tract of the monkeys. We next measure at 6 months after infection the level of IgG and IgA against both the total spike and the RBD domain. And as you can see, both monkeys develop a response against the viruses. Next, we decided to measure different cytokines which might be involved in the inflammation. We are able to see that, for example, one infected monkey, convalescent one infected monkey, have a higher level of IP10 or a higher level of IL-6 or IL-23. Based on this, we decided to investigate the possibility that the virus could persist in the cells in the bronchoalveolar lavage. So to perform that, we extract total RNA from bronchoalveolar lavage cells, and we measure viral RNA in this extract. And we are able to detect in 12 out of 15 one infected monkey the virus at least 6 months after the acute infection, and we are also able to detect 5 out of 10 Omicron infected monkeys. So we decided to classify the monkey according to the level of viral RNA that we were able to detect in the total cells. And 6 one infected monkey and 2 Omicron monkey were classified as high expressor, meaning that they have a high level of viral RNA in the bronchoalveolar lavage. 6 one infected monkey and 3 Omicron was classified as low expressor with detectable level of RNA. And 8 monkeys were classified as neg or no expression, meaning that we are not able to detect any viral RNA. So we next decided to look for which cells are responsible for the expression of viral RNA. To do that, we use an antibody which were developed by the Hugo Mouquet teams, and we perform intracellular staining of cells. And you can see that the antibody on the dot plot are able to show, in fact, some cells which are expressing spike proteins. We perform flow analysis, and we are able to detect that, in fact, macrophages are responsible for the production of viral RNA and spike protein in vivo in our monkeys. So we decided next to isolate the macrophages and to put them in culture. And after 8 hours of culture, we are able to detect both NSP3 protein and double-stranded RNA, suggesting that the virus is able to replicate in those cells. We also found some events of synthesia, which are typical from which are generated by the viruses when it replicates. We also found some macrophages generating tubulin nanotubes. And it has been previously described that this structure facilitates the dissemination of the virus among cells. And we follow the production of spike protein during the culture, and for all the monkey, even for the monkey which are classified as negative, we're able to detect after 12 hours production of viral particles. So we next we isolated macrophages, or we harvest macrophages from our culture, and we perform nanostring analyses, allowing the follow-up of 900 genes. And as you can see, most of the genes involved in the inflammatory response are downregulated in macrophages infected. We found few genes which are upregulated. Among them, there is the two alarmin S100A and S100B. We also found an increased expression of the fibronectin-1 and the marker CD11B. We perform an enrichment of, and we found that in fact macrophages which are infective have an increase of pathway involved in lipid production. Next, we look for a cytokine which could participate to the blockage of our replication, and we focus our attention on interferon gamma. We're able to see that when we put interferon gamma on the culture, the virus seems to be stopped in their replications. We confirm this by doing measure on a culture of macrophages cultivated with or without interferon gamma, and as you can see, the amount of double-strand RNA was decreased 8 hours after the beginning of the culture. So we next look for cells which we hypothesis that a deficiency in interferon gamma production by the immune system could contribute to the heightened viral replication within macrophages. So to study this, we decided to look for different immune cells. And here you can see a UMAP analysis of different immune cell populations, such as CD8 T cells, CD4, CD34 positive cells, NK cells, B cells, and different type of myeloid cells. And we are able to demonstrate that, in fact, NK cells were blocked in their capacity to produce interferon gamma in convalescent monkeys. We performed deep sequencing of NK cells in those monkeys, and you can see that the monkey clusterized differently according to the level of virus present in their detected in their bronchoalveolar lavage. Among the genes which are upregulated in the NK cell isolated from the bronchoalveolar lavage, we found FOXG1, and FOXG1 is known to be involved in the regulation of interferon gamma in CD40 cells. By the way, we found a lot of genes which are up or down-regulated when we compare NK cell between the blood and the bronchoalveolar lavage. Among the receptors which are highly expressed in the NK cell isolated from the bronchoalveolar lavage, we found TLR4, TLR1, and TLR2. Therefore, we decided to see if the virus could stimulate NK cells. So to perform this, we isolated NK cells from bronchoalveolar lavage. We put them in culture with spike protein, and we're able to see that, in fact, spike protein induce a response of NK cells when it add in the culture. And the response was different according to the expression of NKG2A. NKG2A is an in vitro receptor involved in the control of NK cell cytotoxic activity. We also decided to investigate the consequence of interferon gamma production on macrophages, and we found that, in fact, when macrophages are cultivated with interferon gamma, it induces an increase of MHE, and MHE is the ligand for NKG2A. So we suspected that, in fact, as you can see, that the upregulation of MHE at the surface of the macrophages concomitantly to the blockage of the replication should be used by the virus to block, in fact, the release by NK cells. So we look for peptide, and we found some peptide which are able to stabilize the MHE at the surface of the cells, as you can see as this dot plot here. And the stabilization of MHE was dependent of the concentration of the peptide that we put on the culture. Having doing this, we test, in fact, if the peptide were able to block NK cell cytotoxic activity. So we load target cells with different peptides, and we are able to demonstrate it that, in fact, when the peptides are loaded at the surface of MHE, cytotoxic activity of NK cell was inhibited. Interestingly, when we clusterize the monkey according to the level of viral RNA, we were able to show that, in fact, the monkey with low viral RNA or undetectable viral RNA have a good capacity to recognize and to kill macrophages. So we propose this model in which macrophages could harbor some latent infective viruses. The virus could be reactivated, we don't know exactly how, and be transmitted to epithelial cells, which lead to a spread of the viruses and amplification of the response. In This context, it could activate NK cells through TLR2 or TLR4. We do not exclude that the virus could be raised directly by macrophages to activate NK cells. This leads to a response of NK cells which produce interferon gamma, which participate to the maintenance and latency of the viruses. By the way, it could also induce the activation of specific subset of NK cells, probably mature, adaptative NK cells. And in this context, when the virus presents peptide through MHE, two options could occur. Some NK cells which are adapted to the viruses will kill the macrophages. In the other case, the macrophages the killing of the macrophages will be blocked, and the virus could persist in the macrophages. So I would like to thank all the members of our unit, especially Marie, Emma, which are involved in this project, Roger Legrand of the Imit Center, which they take care of our animals, and Hugo Mouquet, Cyril Planchet, and Pierre Rosenbaud for the help. You for your attention. If you have any questions, they are welcome.